Welcome back. This is still Breakfast Daily right here on City TV. Now, we're about to get into some health conversations, and we want you to be a part of those conversations. So please do WhatsApp us on 0550-585-832, and make sure that, of course, if you're texting us and you live outside of Ghana, you use the country code +233. You can use the hashtag Breakfast Daily as well to join in the conversation. And before we introduce our guests, let me just do this birthday wish that has come through. Happy birthday to Mrs. Cecilia Avoclia. Is that right? Avoclia. Yeah, Avoclia. Yes. Happy birthday to Mrs. Cecilia Avoclia, seasoned TV director and lecturer at NAFTI. This is coming in from Samuela, Mrs. Adu Ayi herself. God bless you for teaching me to be an amazing TV director. Wow. So happy birthday to you, madam. Yeah?
Yep. Well, fantastic. Well, we're going to get into the health conversations. As Apioko just said, we've been joined by Dr. Kelvin Owusu, the head of Occupational Health and Wellness at the Claron Health International. And Dr. Kelvin, it's good to have you this morning.
Good to be here. Good to be here. It's been a bit of a dull morning, but I'm happy to be here.
I think yesterday and today.
Yes, yesterday too.
Yes. I mean, it's much deserved a break from, the dust and all of that, those things. Yeah, we take it like that. Yeah. At least it's not heavy, so.
No, yeah, that's true. That's
just
true.
a very light showers, here and there. So, Doc, today we're talking about something that, I think we've had this conversation before, but of course that was quite a while ago, some years ago actually. So let's revisit that conversation today. Vaginal odor. Yes, or vaginal odor, however you want to pronounce it. Yes, so we wouldn't like to hear such words on TV, but it's a health conversation. But why are you making a face like that? Why? What's wrong? Are you okay? Should I get you some coffee?
Yes, please.
But Doc, let's talk about this, because a lot of women battle with this.
Yes.
Some don't know how to deal with it. Some have been dealing with it for years. And for many, it tends to pop up at certain times, of the month or of the year. So let's just talk about it. I'm throwing it to you.
No, I mean, it's always good to revisit such topics, because as human as we are, and as women as they are very stubborn. Yes.
What kind of attack is this?
Oh, yeah. I mean, I'm speaking as a doctor. Forget that I'm a man. I mean, because you'd have thought that since we've spoken about this over and over again, they would stop doing certain things that actually bring these things on themselves. Because indeed, a lot of vaginal odor is self-induced. I mean, let's start from there. It's self-induced.
Ladies, I hope you're listening. A lot of vaginal odor is self-induced. So if you're battling with it, pay attention.
Yes, it's self-induced. I mean, you have to always remember that the vagina is part of your body. So your general personal hygiene, also affects that area as well. So if you are not keeping yourself clean or yourself well enough, it can also show up as vaginal odor, just like you can have body odor or mouth odor. Of course, there's a degree to which it can be as a result of infection or as a result of a condition that you are going through. That's definitely there, but a significant majority is also self-induced. You see. So, for instance, I mean, now you go on social media, you sit in a bus, or you just go to any trotro station, or in fact, you just go on a street, and somebody is holding a megaphone and blasting some medication or some treatment that's supposed to keep your vagina clean. Now, for all, you see, God in his wisdom, he created a vagina, and he made the vagina self-sustaining, which means no-go area. You are not supposed to actually put anything there apart from what's supposed to go there. The vagina is self-cleaning. There are cells in there, and when I say cell, I'm talking about the cells that form your body. There are also cells in the vagina that have been purposely built to keep the area clean. You see, so if you remember, if you go back to secondary school, we learned something called acid-base, pH. So the vagina actually has a very peculiar pH, which is a bit on the acidic side, and it's there for a reason. the acid actually kills any foreign bacteria. Oh, but I forgot to do something. Now, we always need to define what the vagina is, because what they say it is in English is a bit different from what it actually is.
Yeah.
So medically,
Medically
yes,
speaking.
medically, or when I mention vagina, what I'm talking about is the canal.
Okay.
Okay.
The canal that connects the outside. The outside, what you see is the vulva. You know, so the vulva, you have the labia majora, labia minora. You know, that's the vulva. Then from the vulva, there's a connection, a canal that connects the vulva all the way to the uterus, the womb.
Okay.
You know, so that canal is what we are talking about. That's the vagina.
Okay.
You know, so that vagina has cells that are
Doctor,
customized.
distinction. A lot of people say that the vulva is just a little knob. So you are saying that the vulva is the entire outer region
What
of the
you see.
vagina. What you see.
Yes, what you see.
All that
The
is
frontage.
the vulva.
Yes, the frontage is the
Yeah.
vulva. Yes.
The frontage.
Yes, so I mean, so once you go inside, then it becomes a vagina, and that area you should actually not go there. You know, I know that culturally they will tell you that when you are bathing, you should clean the place, etc., etc. But medically speaking, you shouldn't actually put anything there.
Okay.
You know, but if you wanted to help the vagina clean itself, then the only thing you're allowed to use there is water. That's all. That's as far as you can go, just water. You know, I mean, typically maybe you are having your period and you feel there's a need to clean that place, just use ordinary water. And it's important because now, especially because I mentioned period, let me just address that. When you're having your period, that's your most vulnerable time, because the only time that the uterus is open to the environment, the uterus is always closed, the cervix is shut tight, nothing goes in.
see.
You know, the only time where the cervix is open is when you're having your period, because it has to open to allow the menstruum to come out.
Okay.
You know, and so at that point, anything can also go in. So if you put anything in there, you are putting yourself at risk. You know, so it's one of the reasons why we say don't even bother. It will take care of itself. You see, because the acid pH over there is there to kill any invading bacteria.
Okay.
But every time you are tempted to put something in the vagina, you distort or you disrupt that
The
pH. You know, most of the time the disruption is to bring it down to neutral or sometimes make it basic, which actually encourages setting
growth of-
the
So
growth
there
of
has
certain-
to be a level of acidity.
Yes, the
I mean,
acidity
so
is
if
very,
you
very
are thinking
important.
about it in laywoman or layman's terms, acid actually tends to be a bit corrosive.
Yes.
So it can kill things.
It doesn't also mean go and
Yeah.
put acid there.
Oh, no. Please, so
No,
please, that's not what we are saying.
I've seen quite a lot in my short medical career.
But Doc, I know we're talking about vaginal odor, but you just said something that and has brought up a question in my mind. So you're saying during a woman's period or your menses, as you know,
Yes.
call it, that's her most vulnerable period because the cervix is open, anything can enter into the uterus or the womb,
Yes.
right? Again, layperson's terms. Have you seen in your practice, or I mean, maybe from colleague medical practitioners who have stories of their own, have you ever seen someone develop some kind of infection or some kind of complication in the uterus because of things that they're introducing?
Oh yes. There's always most women, especially those who are sensitive, I mean, everybody has a different pain response threshold. You know, so most men who are sensitive would notice that usually about 2 to 3 days after their period has ended, there's some degree of tenderness that they notice in their lower abdomen. You know, so
Feels sore.
Exactly. You know, so there's some theory that there's always some degree of infection, because once the cervix opens, there's bound to be something that will go up. You know, so there's some kind of infection that would take place, you know, right after your period. But usually the body is able to deal with it, you know, because that's what the white cells and everything is there for. So there's a level of control, so they'll deal with it, and within 2-3 days you are back to your normal self. You see, but sometimes, and depending on how much of an introduction of germs you've pushed up there, you're going to have issues. You see, and that's actually one of the reasons why I must be careful in saying this. One of the reasons why we usually don't like tampons, for instance, is because, first of all, most people don't know how to use it, or they keep it there too long, you know. But the whole process of inserting the tampon, you need to do it well, you know, because if your hands are not clean and you are going into that space, you might end up introducing exactly, you know. So I mean, but of course, if it has a role to play, I mean, I admit, you know, but you need to be careful. You need to make sure your hands are extra clean if you're going to be using a tampon, and you need to change it I mean, depending on how heavy your flow is, you need to change it regularly, because blood is a medium. You know, blood is a rich medium, and once there's blood in a place and it stays there long enough, it will get colonized. You see, and I must also add that there are also bacteria that enjoy the acid environment.
Okay.
In fact, one of the commonest vaginal infections or infestations is yeast. You know, candidiasis, for instance. It's actually a normal flora of the vagina.
Okay.
When I say normal flora, it means that it's actually a citizen of the vagina. It actually lives there.
Candida.
Yes, that's where it lives, right? The problem is that because of the acid that's already in that environment, the acid and they have an arrangement, so it controls the population.
Okay.
You know, so when you as a person or as a woman, you introduce things in there to try and clean the vagina, you distort that pH that is controlling the candida population. So now the candida overgrow their boundaries, and then you now start having issues. You see, and even related to that, the way we even handle our underwears, not we, I mean, the way some women handle their underwears, you know, because typically most mothers will teach their girls that you don't hang your underwears outside.
Nobody should
so
see
that
her.
the boys will play with it. You know, that's actually some of the weird things that we hear.
Well, I mean, of course, because culturally, you're living in compound houses, you're in the open, or you don't even have a wall around your house. I mean, Ghana, yes, you have urban areas, but there are still communities like that, you know.
But as a result of that, we tend to culture our own yeast infections. It's because yeast is a mold. When you leave bread in the
damp environment.
in a damp environment. So when you wash the underwear and you hang it in your bathroom, remember the bathroom is already a damp area. You know, even without, oftentimes you find these the mold already growing in place if you don't clean the place well. So the bathroom is rich in mold. And then you hang your underwear there, the sun doesn't actually shine on it. The sun actually tends to kill these things. That's why you don't find mold growing in sunny areas. You know, so then now you have the yeast already in the panty, you wash it, you hang it in a damp area, it begins to multiply. So when you wear it, then you reinfect yourself, you know. So instead of correcting this thing, people rather assume that they get their yeast infection from sharing a bathroom. So you actually typically hear this often, but it's actually not the case. You most likely get it through self-infection.
Okay.
And then it then progresses to the vaginal odor. You see, because once the pH is disrupted, anything, it's open season, anything can now grow in the vagina. So every time you are tempted to put anything in the vagina, just remember that is the #1 cause of vaginal odor.
Okay.
You see, very important. But having said that, I did mention that there are other reasons why there can be vaginal odor, such as infection, which could still be an offshoot of you interfering with the normal processes over there. You know, but some infection like bacterial vaginosis, for instance, is another of the common causes of vaginal odor. And typically, it has been said that the odor from bacterial vaginosis is like spoiled fish. You know, so if you have had that experience, you know what I'm talking about. So if you have any smell that smell like spoiled fish coming from that area, you know, it could be a sign that you have what we call bacterial vaginosis. It's not an infection from one particular bacteria. It's like a combination of different bacteria, you know, bacteria that gets in there, and then that gives off that classic odor. It's treatable, you know, so you just need to be observant and then deal with it. But of course, having said that, there's also, I mentioned personal hygiene earlier. Remember that the area, the groin area, is also an enclosed space and also sweats quite a bit. You know, so if you don't deal with your sweatiness or your changing,
especially in our climate,
exactly, changing your underwear as often as you need to, it can also develop body odor. If you keep a bush in that area, your pubic area is bushy. Remember that the pubic hair also sort of traps a lot of things. The last time we had a session about it, it traps dirt, it traps germs, you know, it traps sweat as well. So it keeps the place a bit more humid than a well manicured pubic area would do. So that also encourages odor. So if you are keeping a bush down there, you need to be increase your personal hygiene so that it doesn't become a cesspit.
So, Doc, 2 quick questions before we wrap up. 1, the soap or detergents that we use to wash our underwear, does that in any way, shape, or form affect the vaginal area? And then 2, how often should women change their panties in particular, their underwear?
So everything affects everything. You know, so I mean, depending on which soap you are going to be using, you need to know what the soap actually does. You see, because there's also a proliferation of antibiotic soaps. You know, in our quest to be extra clean, we are also using a lot of antibiotic everything, and the research is a bit out there. I mean, it's a bit conflicting whether you should use it or you shouldn't use it, because it's been building of resistant germs
Bacteria,
has been attributed to some of these occurrences. You know, so you might be actually putting yourself at risk of resistant germs. So it's a bit too early to make that conclusive comment. You see, but if you wash the underwear and you don't rinse it well and there's still soap in there, you wear it, yes, it could affect it, because remember that it's still the same pH you are talking about.
Okay.
You know, so you don't want poorly rinsed, even on your skin, your regular skin, when if your shirt is not well rinsed and then you wear it, it feels yes, you itch or something. So, and the skin of the vaginal area, in fact, this time the vulva vagina is very sensitive. You see, so you don't want to put anything there that's needn't be there. You see, because even if I mean, I have actually attended a patient who wore jeans, it was quite tight, and came in with friction burns. You see, so that's how sensitive that area is. So you don't want to put anything there that you don't want to have negative consequences. It has also been documented that it's better to wear cotton. You know, cotton underwears than any of the synthetic materials. You know, so cotton, because cotton is breathable. You see, and so it's better you wear cotton. Of course, and now we have a lot of different kinds of underwear. So people are wearing G-strings, all sorts of things. You know, now depending on how, if the material is too thin, you see, it can go into places it's not supposed to go. And now you need to.
Okay.
Now, David, what's going on here?
That's right.
And remember that.
Abayobo, you do that.
Remember that the vagina is very, very close to the anus. Now, I don't know why God put them so close together, because the anus has its own specialization. There are also bacteria in there that you don't want in any way to come into the front. So I'm sure that as I remember this from life skills class, those times I don't know what subject where they are teaching this now, but they will tell you that when you are cleaning up after using the loo number 2, you clean from the front to the back. You see, because the anus it's a dirty area, so it can handle any bacteria that may come from the front to the back. However, the vagina is a clean area, so it may not be able to handle the dirt that will come to the front. So you never, as a woman, you never ever. I mean, if there's one thing that you should never ever do,
cardinal rule.
Yes, number 1 is never do a back to front, because if you do a back to front, you are going to cause problems. And so we need to begin to teach our girls this from very early. Once they start doing their own self-care, we need to start teaching them, because it can be a source of distress. You see, now in extreme cases, infection can actually track upwards into the uterus and come out to the fallopian tubes, and that's how you now develop a pelvic inflammatory disease. I'm sure you've heard that before. And a poorly treated PID, that's pelvic inflammatory disease, can result in infertility, because it can result in scarring of the fallopian tube, so that the tubes will actually will close down, so no air can pass through. So you know, even though we are discussing this on a lighter note in the morning, it can actually be a source of great distress later on. So we want to deal with it now.
Okay, Doc, we need to wrap this up soon, but the questions are pouring in. So this one says, "Hello, Apioka and David. This is a very insightful conversation. Thanks for discussing." That's from Amma Newman in Abri. Good morning, Amma. Does regular discharge cause odor too? And that's from Marianne in Santa Maria. And then I'll add one more question so I can take them both. If you dry your panties in the room, can that cause this? Doesn't necessarily have to be dried in sunlight. I think you addressed that. That's from Belinda in Tema Community 5. So maybe you can reiterate it for Belinda.
So the sun is our cheapest disinfectant, really. Cheapest disinfectant. So when you hang in the sun, the UV rays automatically kill any bacteria that would or fungi that are resident in the dress you just hang out there. So the sun is cheap. You know, if you're not going to use the sun, you may have to then use a dryer, you know, the washing machine dryer, which is quite expensive. So the sun is the cheapest option. So even if you are planning on hanging,
what about an open fan? Like leave a fan.
The fan
on.
doesn't do
So the heat. What about ironing?
Ironing, so
Okay.
that's what I was going to mention. So ironing is also an option if you're going to, if you still insist on hanging in the room, then ironing is the alternative again, but still expensive. But yes, it works.
Somebody says, "What about a hair dryer?" No, I mean
That's a
it.
pretty tedious way of doing it.
Yes, but the hairdryer. Okay, so I mean, I haven't done any research on the hairdryer per se, but there's research on the hand dryer that we find in washrooms, typically in washrooms,
Okay.
which has been documented to be a storehouse of germs. So personally, I don't use I don't use hand
So
dryers.
put your hands
Neither
under
do
the-
I.
put
I
your
actually
hands
have
under
a
the
fear of the, like,
hand
I don't
dryer.
know why.
It's just you just
So the germs are just.
Ju-
Oh Lord.
wow.
This has actually been documented. So
Deliver
this
us.
is not me mentioning this. So I don't know if the hairdryer can fit in that category, in which case I'm not going to recommend that you should use a hairdryer to do this task.
Interesting.
You see, so yes, so I can't answer it directly, but by inference, you know. Now, discharge, depending, so women naturally have a discharge, you know, and that discharge, the consistency, the color, the odor would vary according to their menstrual cycle. You know, menstrual cycle is some people 28 days, some people 32 days, some people is 25 days, you know, so you should know yourself. And once you begin to study yourself, you begin to realize that at some point the discharge has its own characteristics, you know. So if the discharge is what you already know as normal for yourself, it usually would not cause much problem, except if you are not changing your underwear as often as you should. Some women typically have not so much discharge. Some women have a lot of, I mean, human beings as everybody is complicated, everybody is different. I mean, it's amazing how different and yet how alike we are. You know, so you should know yourself. If you have copious discharge, you need to change your underwears more frequently, or use a panty liner, which helps.
So
you see.
just on that, so Oba from OEB says, you mentioned that candidiasis is normal, or candida. Not candidiasis is infection.
Yes.
Okay, but she says, does having some fluid, say whitish or yellowish, but doesn't have any odor, mean that there should be a treatment?
I mean, it depends. What are the other features? Is it itchy? You know, how copious is it? Is this what's it called? Is it smooth or is it granular? It's because all these things matter. So and is it a recent thing or something that you have had all through your life? You know what I mean. What I'm trying to ask is it a normal part of your cycle? Because you are the best person to tell us. You see, because if you came to me and you don't know all these things, then we would then have to do more laboratory.
You also have the corpus
investigation.
luteum and all that in there. See, I was a biology student too.
You know, so yes, so all these, so it begins with you knowing yourself. You see, because once you know yourself and you know the characteristics that you have at which point in your cycle, it helps us to make a diagnosis more accurately and faster too. Okay. You see.
And then Lena and Afienya, last one, panty liners, are they a contributing factor?
How often you change it counts. If you use a panty liner and you're keeping it for too long, it then also becomes remember, anything that comes out of the human body is rich medium for bacteria to make use of. So if the panty liner stays on in your area too long, it becomes a breeding ground for the bacteria. You see, so it depends on how often you are changing it. Typically, most people will change it twice a day, which so far has been fine. If you discharge heavily, then you might need to change it more frequently. Same with your menstrual pads. You know, you need to change it frequently depending on your how heavy you are bleeding. But typically, at least change it 2 times a day.
Okay.
Dr. Kelvin, thank you. Suddenly, granny panties don't look so bad.
It's the safest bet. Really.
But some granny panties are actually very nice looking. I'll take you to a place quickly. I'll take you
Dr.
there.
Kelvin, where can people find you? Where can they reach you?
Well, you can find me on social media at Kelvin Owusu MD on all social media channels. And you can also follow my clinic page and Claron Health International.
All right. Thank you.
Thank you, Doc.
We're
Thank
speaking
you.
with Dr. Kelvin, and he's been, explaining the details that we need to understand all about that.